My name is Gary Howe. I'm a Senior Service Transition Manager with Connect Health. I'm a clinician by background, so an advanced physiotherapy practitioner, but my work in more recent years has been in the mobilisation and transformation of services. We work as a change partner for a number of NHS trusts and organisations in England and now Wales. So we work with 26 CCGs or health boards, and we see 350,000 patients per year through our pain, rheumatology, CATs and physiotherapy services. I'm going to be presenting today with Zoe Brewster, who will introduce herself in due course. And we're going to be talking about our innovation PhysioNow and how it's been used in Wales. So just to start off with, I'll explain a little bit about what PhysioNow is. So it's a clinically led digital chatbot. So it takes patients through the subjective component of their musculoskeletal physiotherapy assessment. So that's the information gathering part of the assessment, which then decides what would be the next best steps in the patient journey or management. It's online, so patients will get a link and then they can access it at the time and place of their choosing, available 24/7 in both English and Welsh. Sophisticated algorithms like the ones on the screenshot will sort of guide the patient through the subjective assessment component and produce an outcome for them. And those have been developed in conjunction with our software partner by our senior clinical leadership team. And these people have been involved in the co-production of NICE guidelines and have spoken internationally at conferences. So they've underpinned the decision-making tree that the patients will use. And there's over 3,000 clinical scenarios that a patient might go through. And by doing that, we believe that we get it right first time for the patient, so that they'll see the right person at the right time in the right setting and remove any unwanted variation. And PhysioNow will do that by producing an outcome, 5 different potential ones for a patient when they've completed it. One outcome might be your more urgent cases that are beyond scope of musculoskeletal physiotherapy, your cauda equina, acute joint infections, DVTs, those things that need to be seen on a time-sensitive nature by the emergency services. PhysioNow will signpost them automatically, meaning that they get to the care that they need instead of sitting on a waiting list. It'll also prioritise those urgent physiotherapy assessments. So if patients have a high pain index or have ridiculous symptoms and need to see a physiotherapist quicker, it'll prioritise them. A third potential outcome is for your more routine physiotherapy assessments, so they'll be seen within the timeframes of local pathways. Fourth potential option is for patients to be seen within the CMAT service and bypass the Tier 1 service, so thinking things like trigger finger who might need an injection and wouldn't need to be seen within Tier 1 physiotherapy beforehand. And the fifth potential outcome is the one that we're most excited about, and it will be developed for the rest of this year and be available towards the start of next year, is the self-management outcome. So whereby patients could be provided with some exercises and some education and support packages and may never need to come in to see a clinician or speak directly with them and get the care that they need that way. Just to finish off this little bit, how we came to come to working in Wales was part of Life Sciences and Wales Government, a digital solutions response to COVID, and we went through a selection criteria, interviews and a process of selection, which led us then to start working with 2 health boards in Wales, Zoe's team in Cumtaft, Morgannwg, and John Davies in Haldal. And we've been working on the pilot with them for the last number of weeks, up and running now and going really well. And we'll talk a little bit about that more towards the end. But first of all, I want to introduce you to Zoe, and she's going to talk you through the positive impact that PhysioNow is having on her local pathway.
Thanks, Gary. My name is Zoe Brewster. I'm one of the assistant heads of physiotherapy in Cumtaft Morgannwg University Health Board. We've been really privileged to work with Connect Health and the Life Sciences team to start to work on the PhysioNow project. We're early days, we're in a pilot of 500 patients, and we're seeing how the PhysioNow option affects our patient pathway. So the pathway that you can see in front of you, named Previous Pathway, is quite similar to what many of us across Wales may be used to. So our administration team would receive referrals from a number of places. consultants, GPs, and some self-referrals. Our clinicians would then triage these referrals before our admin team offer an appointment to the patients. Our normal appointment times might be somewhere between 30 and 60 minutes, average of around 40 to 45 minutes for a new patient appointment. We can see that the PhysioNow option, which allows patients to self-refer using the previously shown slides, which gives patients the opportunity to have a really detailed assessment over the internet. And we can also direct other patients who have already been referred to us by a consultant or similar referrals to create and answer some more questions via the PhysioNow option. We're quite early days, but we're auditing the clinicians' triage against the PhysioNow triage, and we've already got 100% marry between the two, which means we're able to take steps towards our admin staff using the PhysioNow triage to book first appointments for patients. We're seeing that the subjective assessment that's completed through PhysioNow will allow our clinicians to spend really good quality time with the patients, not just completing the subjective assessment, but starting really early rehabilitation where that's appropriate. And that's ultimately what we're here for, is to give the best quality care we can for our patients. Hopefully you can see on the side that there's really good savings in terms of clinical time, but also admin time, with just a small group of patients as part of the pilot of 500 initially. As I said, early days, but we're starting to see really positive patient feedback. We've already seen 80% positive feedback in terms of patients recommending our services to family and friends, but also a real huge priority for this pilot is the feedback that we've had. Around 90% of patients saying that there is great ease of use from this system. Again, we're moving towards the digital innovation and seeing how patients use the system is really great. Our clinicians are also able to share positive feedback that they can just recap that subjective assessment and start that rehab early because they're able to spend really good quality time with the patients. I think there's some other benefits that Gary will be able to share with you around the wider health system.
Yeah, thanks, Zoe. So we know that patients can self-refer using the app, so that's going to free up a lot of GP capacity at the minute, which is great because better utilisation of that in the health system will benefit us all. We also know that Zoe's team and John's team can better use their capacity within services to cut down on waiting lists, which is having a big impact on local services there. And we know, thinking about the patients again, that the ability to complete the assessment at home means that they don't have to miss out on any family time or potential work time. So great travel savings for people that way. And there's other benefits as well, but we'll not go into those at the minute. And thinking then again of the future, so we're keen to continue working with Life Sciences and Wales Government in the hope that we can roll out PhysioNow into all health boards across Wales, and also thinking about how we at Connect Health can maybe have some benefits on local pathways and systems there. Just to finish off with, thank you for your time, and if you do have any more queries regarding PhysioNow, please just get in touch with either myself or Zoe, and our details are on the slide. Thank you.